This is Brad, and this is Wendy. They are licensed clinical therapists at the Department of Workforce Services. Each employment center has a licensed clinical therapist as an additional resource for our parents in the Family Employment Program. We understand that life is stressful, and balancing many responsibilities can be tough. Everyone could use a little extra support sometimes. We also recognize that meeting with a licensed clinical therapist may sound scary, so let's cover what you can expect when meeting with a licensed clinical therapist and some of the options you could work on together.
Our licensed clinical therapists are here to help you and your children while you are on the Family Employment Program. Everyone's needs are different, but here are a few things parents and licensed clinical therapists have worked on together in the past. Life and work balance, coping with stress, promoting emotional well-being, anger management, parenting strategies, healthy relationships, mood and anxiety disorders, and trauma healing. If you are interested in receiving support by a mental health professional, but would feel more comfortable doing so outside of workforce services, the licensed clinical therapist in your local office is happy to give you a referral for other providers in the community. If you are already working with a mental health professional, a licensed clinical therapist can also coordinate care to support your family success in the Family Employment Program. This may include working with your employment counselor to determine realistic and achievable employment plan activities, which we will discuss in more detail in the next video.
After you have been determined eligible for financial assistance, you must complete a substance abuse questionnaire to determine if substance abuse may be a barrier to your family's success. If it's determined you have a high probability of having a substance abuse disorder, your employment counselor and licensed clinical therapist will determine additional screening requirements, which may include drug testing and connect treatment services to support you. Here are the steps you can expect in this process. Every parent who is approved for financial assistance must take the substance abuse questionnaire. If the questionnaire shows low probability, no additional action is required. If the questionnaire suggests a high probability of having substance abuse disorder, additional screening is required. You will be notified either through the message center in your individual job search account on jobs.utah.gov or the mail with directions about the next steps. The follow-up steps are very time-sensitive, so please contact your employment counselor or the licensed clinical therapist as soon as possible if you have any questions regarding this process.
Here's what one of our customers had to say about the licensed clinical therapist that helped them.
There was a gentleman at Workforce Services who was a licensed clinical therapist, and he was phenomenal. At first I thought, who are you? I'm already trying to deal with this on my own. Why do I have to speak to somebody else? It was kind of scary, but it ended up being so wonderful. He recognized that it could be a very big struggle for me getting back into the swing of things and establishing life for me and for my family. It was so beneficial, and the licensed clinical therapist was great. He helped me not only get back into work, but helped me find a healthy standpoint for everything.
As you can see, a licensed clinical therapist may be a great asset to your support team at Workforce Services. Together with your employment counselor and licensed clinical therapist, we will support you and your family as you increase your self-confidence and achieve success. In the next segment, we will share with you some of the activities and resources of the Family Employment Program.